Hi, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything education for pain management. Today the topic is, what does it take to get a spinal cord stimulator? Now, for those of you who don't know what a spinal cord stimulator is, it's a device that is implanted underneath the skin with a battery pack that also doubles as a program generator that has a wire coming out of it that feeds up around the spinal cord and gives off electrical impulses. And it can change the way the brain perceives pain signals in whatever area is painful. Might be your back, might be one leg, both legs. But what it does is it sort of trades out the pain for like a warm tingling type sensation that can be a lot more pleasing than the chronic daily pain. So for a person who's had surgery that failed, who's had surgery that succeeded, but then over the course of a few years developed scar tissue around a nerve root and leg pain resulted, there might not be another surgical answer. So a spinal cord stimulator can be very helpful. Well, if your pain management doctor feels that you're a good candidate for a spinal cord stimulator, that you're sort of on that last resort, end of the line, out of other options, surgery's not indicated anymore, pain medication's just not quite doing it, injections aren't quite doing it, and it may be for diabetic neuropathy, it may be for failed back surgery, whatever the case is, there are two steps that you have to go up, basically, to get the stimulator implant. The first is a trial spinal cord stimulator implant. It's done as an outpatient. You are semi-awake when you get the trial. And the reason is, this is what happens. The pain doctor uses an x-ray machine called a fluoroscopy and numbs up the skin and then inserts a catheter, which is electrical lead, into the spinal cord area. It's called the epidural space. And then they implant it in such a way, they position it and say, okay, after they turn it on, do you feel the tingling sensation where normally your pain is? If you're asleep, you won't be able to tell them that, right? So that's what they do, is they put the lead in and then attach it outside the skin sterilely to this programmer, turn it on, and then say, what does that feel like? And if you say, I like the way it feels, but it's not quite in the area, it doesn't cover the whole thing, they'll move it a little bit, and then move it until it fits the area of where the pain normally is, okay? So you wear that, they sterilely dress it, suture it in place, 5 to 7 days, keep a log of how much pain control is achieved, and it gets taken out in the office. It's a simple, cut the stitch and then pull it out painless, okay? So if you achieve 50 to 80% pain relief, that is great. That is really good, okay? Then you're indicated for the final implant, but not so fast. You have to go through the second step, which is a psychological screening. Now, a lot of patients hear this and they're like, I'm not going through a psychological screening. There's nothing mentally wrong with me. Well, you don't really have a choice because by and large, most insurance companies require it, okay? Now, what it can do is it can pick up through the instruments that they use, like the Minnesota multiphasic, these scales that they use, it can pick up depression or anxiety or catastrophizing. One of these things you may not realize you have, but it can pick it up. And studies show that spinal cord stimulator implants don't work as well if those are coexisting, okay? So it might be that you need to get that treated first with anti-anxiety, depressant medication, whatever, and then you have the spinal cord stimulator implant, okay? So don't poo-poo it. It can be a very helpful step, and by and large, most insurance companies require it. Those are the two steps, okay? Check our website out at preferredpaincenter.com. There's a lot of information on pain conditions, treatments, and about the Arizona Pain Specialist clinics. There are 4 of them. They all have board-certified and fellowship-trained pain management doctors, chiropractors, acupuncture, spinal decompression therapy. All right, they have a slew of options to help get rid of your pain. The pain doctors all do the spinal cord stimulator trial implants for you, okay? Call for scheduling at 602-507-6550. The clinics accept over 50 insurances: Medicare, Medicaid, self-pay, commercial, workers' compensation, and personal injury liens. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.